My name's Aaron Levo. I'm the Vice President of Communications and Public Affairs. A little bit raspier than usual today, but still happy to be here moderating our town hall, our all-staff town hall. As is normally the case, we'll have a lot of presentations. We have a packed agenda today and want to get through that. We'll also pause at the end for celebrations, but we do have a slight change today. We won't have an open Q&A forum today. We have noted that in the last several webinars, the questions have been quite frequently dominated by a select group of people. And we've been answering very similar questions, which I know takes a lot of time from our panelists. And we still want to make sure that everybody does have the chance to answer or get their questions answered. And so we would ask that people do post questions to the HHS News at hhsc.ca inbox. You will get an answer if you send an email to that email line about anything that you hear today. We're also going to pause. I'm going to do a Q&A that's based on some of the more popular questions that we've received since the last week around a couple of our topics, just to make sure that we are as well respecting the questions we are getting from our audience, but won't have the live Q&A today. So I guess that's all the housekeeping for now, and I will turn it over to our President and CEO, Rob McIsaac, to kick things off. Rob, over to you.
Thanks very much, Aaron, and good morning to everyone, and thanks today for joining. As we begin, I want to acknowledge that we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. And that's an appropriate way to start today's meeting. Maybe I could just pause very briefly to say, and I know Sharon is likely to touch on this, but I know many of our sites are highly pressured, and just wanted to acknowledge the work that everybody is doing to accommodate what seems to be a very high burden of illness in the community right now. So we do have a very full agenda today, so we'll dive right in. And I think a very pleasant way to start, I'm going to welcome Kelly Campbell, who is Vice President of Corporate Services and Capital Development, and the 2021 HHS United Way campaign chair, for an update on the campaign, which is quickly coming to a close. So Kelly, over to you.
Thanks very much, Rob. So as Rob mentioned, our campaign is quickly coming to a close next week. It's the month of November. So as November 30th rolls around, we're in that home stretch and really looking for people to support the campaign. Certainly, thank you to all of those that have helped us raise money so far. We know, however, the majority of our donations come in the last week. So this is really that last reminder to make sure you do support the very important work that the United Way provides. We do have a fundraising goal of $90,000 this year, which is a little more than last year, a little bit of a stretch goal, but we're confident that we can get there with your support. Certainly a successful recovery from the pandemic involves all of us and our support for our community. And United Way is a great way to show with a gift to that very important organization. If you haven't had a chance yet to donate, it's still time to join. Certainly payroll donation is a great way to support in a small way every pay period, and you determine that amount. Whatever it is you can afford is greatly appreciated. To date, so far as of yesterday, we're slightly ahead in our payroll donation, so we're grateful for that. But again, we still look for as much support as we can get. And then also just to acknowledge the great work of our committee co-chairs, Lisa Webster and Kelly O'Halloran, who've been leading a committee that just of volunteers that every year give up their time and their energy to put together some of the events that many of you have participated in. So we thank you for support of those as well. All the information and ways to give is available on our hub and certainly on our social media, our Facebook account. So one last, please support us if you haven't already, and a big thank you to those that have. And back over to you, Rob.
I think I'll take over my normally assigned duties despite the raspy voice and introduce our next speaker, our EVP Clinical Operations and Chief Operating Officer, Sharon Pearson, who will give us an update on our operations. Sharon, where are things at this week?
Thanks, Aaron, and good afternoon, everyone. In terms of our COVID numbers, you can see we're substantially lower than we have been over the course of the last few months, let alone the last 18 months. And this decline continues week by week. So across all the areas that I report on each week, you can see we have less than 5 patients in each of those categories, whether that's ICU ward or ECMO patients. And you'll just note the notation when the number is less or 5, we don't provide the exact number because of not wanting to disclose personal information about our patients, but the numbers are significantly lower, which is very good news. If we go to the next slide, certainly our occupancy pressures are not good news. And as Rob highlighted, we have extreme pressures across all of our sites. I would include the acute and the post-acute sites. So every one of our facilities is struggling with the pressures that we're facing right now. You can see the inordinate occupancy pressures at McMaster, 111% yesterday, and over the course of the last 2 weeks has been as high as 118%. And then within our adult sites, you can see 106%, which translates into some very, very busy and pressured units and departments across all of the facilities. Part of the driver is we are seeing a rise in our ALC. So we had plateaued for a period of time around 150 patients, but week by week, we're starting to see that increase now. So we are at 185, and over the last 2 weeks have gone as high as 188. In order to address the surges that we're seeing in our activity pressures, we do have our unfunded and surge beds open, maximizing as many as we can. And at this point, 76 across all of our sites, with the majority of those being at the Juravinski site. If we go to the next slide, obviously the challenges are the volumes that we're seeing arriving through our ED department. And as I've reported previously, we are back to our pre-pandemic volumes. And in some cases, such as McMaster, we're exceeding those volumes. And anecdotally, we're certainly hearing about the impact of the last 18 months on our community. So patients presenting with advanced diseases as a result of delayed and deferred care. We also continue to experience, and the challenges really increase in the community in terms of programming that they're able to provide that support our patients and either prevent them from coming to hospital or support those discharges. Certainly bedded capacity is a challenge, but equally the challenge is the health human resource across the sectors, including the community and home care sector. I would just highlight the long-term care capacity pressures and recall that as a result of COVID, there are no more ward beds within long-term care. So any homes that had 4 bedrooms had automatically reduced to 2 bedrooms. So we lost a significant amount of capacity over the last 18 months. And we're just working with the province to ensure we see the homes maximizing their capacity at this point in order to help the flow across the sectors. And really starting to see the impact of all of the smaller hospitals and equal size hospitals that are struggling with increased waits. So what we see are some individuals moving from hospital to hospital in hopes to find a shorter wait time or easy access to specialist care. The impact, unfortunately, the deleterious impact is the surgical cancellations, and we have had to cancel cases this week at the Juravinski site. We see that increase, continued increase in the admits to no beds. So starting most days with 65 or more patients waiting for a bed before we even begin our day. And the impact on our EMS partners is significant. We have experienced peaks in our ambulance offload times, and that then the sequelae is an impact to what's available in our community in order for the EMS services to provide the urgent access that we need. So many pressures that result from our own internal pressures. We continue our work on our Flow and Access Committee, our corporate committee, in order to advance our strategies to support flow through the system. And we continue to work with our Ontario West and provincial partners to advance some of the higher level system strategies to mitigate the impacts we're seeing in hospital. And with that, I'll hand it back over to Aaron.
Thanks very much, Sharon. Next up on our agenda, we'll have an epidemiology update from Dr. Dominic Mertz, who's our Medical Director of Infection Prevention and Control. Dominic, where are we at this week in terms of the pandemic and its progress?
Yeah, thanks, Aaron. this is how it looks like this week. And you can see on the left-hand side that the case numbers had been going down at the Canadian level and now going slightly up again, sort of plateau right now. What we've certainly seen was a significant decrease in case numbers in Alberta and Saskatchewan that had been driving, I would call it the wave 4A, and now we see an increase in case numbers in Ontario, Quebec in particular, which is now responsible for what's going to happen in the next weeks to come. Next slide, please. That's our provincial view, and you can see that over the last month, we see a relatively slow but steady increase in case numbers, and I would expect that by the end of the week, we are in a similar range as we had been in our wave 4A, end of August, beginning of September. And that's comparable to where we had been back last year in October in terms of case numbers per 100,000 per population. Next slide. In terms of hospital admissions at the provincial level, you can also see a slight uptick over the last month. And we are currently comparable to where we've been at mid-October last year in terms of patients hospitalized with COVID-19. Next slide. Okay, that's the old Ontario model, which based on that very rough red line, as you can see, didn't work out the way it was supposed to. Unfortunately, we see more of an increase than was expected back then. Next slide. The models have been updated, and now we are tracking between that medium and sort of worst case or possible worst case scenario in terms of case numbers increasing, as I said, relatively steadily at this point. And we will soon be where we had been in our first fourth wave, beginning of September. Next slide. In terms of ICU needs, we are still tracking better than the best case scenario here, relatively stable at around 100 people within Ontario being in an ICU with COVID on a given point of time. And that's been relatively stable, as you can see here, since end of October. Next slide. Where do we see those cases currently? And I think the main challenge, the main difference here to previous waves is it's not the GTA or GTHA, it's mostly smaller public health units like Sudbury, Algoma, but also Haldimand, Norfolk, as you're well aware. Niagara has seen a peak, is now coming down as well, and other public health units in the Southwest. So a very different picture. Also, Kingston has done great so far. Now suddenly they have the highest, or are among the public health units with the highest numbers in the province. So a very different pattern. The one pattern that still looks the same, and that's on the next slide, is who those cases are. On the left-hand side, you see again in orange, the unvaccinated individuals, where we now see that increase since beginning of November, much more pronounced than we see that among the fully vaccinated individuals, where we also see an increase, but a much less impressive slope, I would say. Even more significantly so when you're looking at hospital admissions in the middle. First and foremost, it's the unvaccinated. We see a slight increase as well. In the fully vaxxed ICU, I already said, we are relatively stable, and that's what you see here as well. It's a much higher proportion among unvaccinated than the few vaccinated individuals. Typically somewhere between 10 and 15 within the province are fully vaccinated and COVID positive on an ICU over the last few weeks. Next slide. The Hamilton view, slightly different. So we had a very significant first fourth wave, I will put it that way, higher than most of our other public health units. We came down very nicely. Currently, it's a little unclear whether what we see is a hump that goes down again, or whether we might be accelerating along with other public health units as well. We are currently as low as we've been in mid-August between that wave 4A or where we've been in mid-October 2020. Next slide. We are still deep in what we would consider low epi at this point, so deep in the green in terms of unlinked cases with that aren't clear where they may have picked up COVID. Next slide. In terms of hospital admissions, in contrast to the province, given our wave 4A, we see a continuing decrease in number of cases, and Sharon already showed you the numbers currently at HHS. We are lowest since mid-November 2020. We are lower than where we had been over the summer months locally. We've never seen the same decrease that the rest of the province saw over summer, but we are tracking lower now, while the rest of the province tends to increase slowly. Next slide. This is our local modeling. And again, I added a red line of what the actual numbers are. The three scenarios here are the first would have been maintaining all public health measures to the same extent. Dark blue is some level of reopening as planned by the province. And the lighter blue is scenario 2 plus childhood vaccination starting in December. So that's how the model was done. And you can see that we can avoid roughly 100 cases by starting to vaccinate kids in December. Next slide. In terms of hospital admissions, you can go to the next slide here. That's what's predicted for the weeks and months to come until January. Again, a peak mid-December with maybe up to 4 hospital admissions per day. All of this being said, we are currently sitting at 0.5 admissions of Hamiltonians per day. So this is only Hamiltonians, just to be clear. So we are doing much better than was predicted, and hopefully that stays the same and we don't get as high as predicted here. But even then, it would still be better than where we've been end of August, beginning of September. Next slide. Vaccination status, provincial-wide, first dose 89% of 12 plus. We are still tracking behind that with 2.9% less. Next slide, double vaccinated, 86% and 83% in Hamilton. And for the third doses, 3.3% in the province and 3.2% in Hamilton. So very close. Next slide. Now, the news of the weeks are certainly the vaccinations that were available for the 5 to 11-year-olds. Either you can book either through ontario.ca, book vaccine, or call this number, or through your public health units. And on the next slide, you can also see the link for Hamilton, which is hamilton.ca, get your vaccine. Today is the first day I understand that Hamilton starts to vaccinate kids. Some public health units have started yesterday. What's being offered here and HHS is supporting is a mix of fixed site clinics, mobile clinics, school-based clinics, and clinics specifically for Indigenous children. And yeah, you can find all the details on the web, obviously, from hamilton.ca. Next slide. As you know, Health Canada has approved the use of the Pfizer vaccine at the lower dose for the 5 to 11 years old, based on the fact that it's effective in preventing COVID-19 infections and the absence of a safety signal. The benefits are multifold, and probably the reasons why people get kids vaccinated can be a mix or any of those listed here. First, kids can get COVID-19 and spread it to others who might be at higher risk of illness. And we are estimating that vaccinating kids will reduce number of hospital admissions by roughly 10 until the end of January. But that's not 10 kids. That would be first and foremost elderly high-risk patients where we can prevent transmissions. And the other piece is missing school, missing sports, etc., because of COVID, or you may be able to prevent that. As you know, in very rare cases, severe disease or complications can occur, such as MISC or long COVID. And then there's the usual administrative benefits that all the adults or 12 plus at this point can have, that you don't have to isolate after exposure, that you could continue to go to school, or that you can more easily travel internationally once double vaccinated. Next slide. There's also resources on our intranet with the link provided here, where there's now a section added for children 5 to 11 years old as well. Next slide. The third dose or booster shot, I provided a little bit more detail. The last time, the vast majority of healthcare workers do qualify for third dose if your second dose was more than 6 months ago. Next slide, please. As I mentioned previously, you would see most benefit from a third dose if you have older age, because your immune reaction might not have been as strong if you are immunocompromised or were immunocompromised when you received your first and second dose. And if you had a short interval between the first and second dose defined as less than 8 weeks, as you know, at this point, it's a choice and not a mandate. Next slide. How to book it? It's our HHS West End clinic, currently provided daily from 9 a.m. to 5 p.m. starting December 1st, all the days other than Mondays and Thursdays when it's being used as a testing center. And again, you can book an appointment online, or you can also check with your local pharmacy for options for booster doses as well. Next slide. We shouldn't forget the flu shot campaign because of the boosters. We need the flu vaccines as well. We see more activity, in particular in the US, and I think it's a matter of time, and we will see flu activity here in Canada as well. So please get the flu shot. As you know, COVID vaccine will not prevent the flu and vice versa. And it's definitely not yet too late to get the flu shot. Flu is not here yet, but chances are, I would say, increasing that it will be here, and that it might be a very significant flu season as well. Next slide. And here you have the times when you can go to your employee health office and get your flu shots. Thank you very much. Handing back to you, Aaron.
Yeah, thank you very much, Dr. Mertz. Next up on our agenda today, we have Dr. Barry Lum, who is among the leaders that is helping to shepherd along our Project Odyssey to give us an update where we're at on that important transformation. Barry, what do we need to know this week?
Thanks, Aaron. Hi, everybody. You're now quite familiar with our roadmap of the project, and despite the incredible pressure the organization is under, we are still moving ahead, and of course there is a compelling reason for us to find our way into a modern electronic health record. And so June 4 is still our day to go live. We're now well into and approaching the end of phase 3, which identifies the build and testing phase of the project, and we now we'll be focusing, in addition to some ongoing build activities, but in particular focusing on training and the execution of the HHS version of the EPIC Canadian Foundation System. Next slide, Aaron. So as of today, we are 190 days away from go live. And I'll just mention a couple of items on the next slide of things that you should pay attention to, if you would, please. One is, again, about training, and that we will be beginning the registration process for our well over 12,000 staff over the next weeks and into the early part of the new year. So for providers, that's physicians, nurse practitioners, physicians assistants, and so on, that registration process will start on December 20 and extend towards the end of January. And then for our non-provider, which is by far the vast majority of our staff, that will begin in the very early part of the new year, and again, need to be completed relatively quickly. Part of that after registration will be the need to complete the preliminary e-learning activity that needs to be done before you get to your classroom, and we'll be providing you with information about that. And that does need to be completed before you actually go to your classroom training. You're going to hear about something called Day in the Life cards, which are cue cards, for lack of a better term, that describe some of the activity and how you'll be impacted in the EPIC world. We've got over 50 of them so far, and they're really meant to show you a glossary of some of the terminology that you'll get familiar with in the EPIC world. And then on one side of the card, it'll talk about what you did before, and on the opposite side, what you're going to do in EPIC, and just help you understand what that will look like. And of course, we continue to deliver our devices across the organization. The WOWs continue to be deployed. The large screen monitors are going up. I think you're going to find those are really cool as we go forward. And of course, other desktops and so on will be coming along. We are struggling a little bit with the devices arriving, which is not surprising. Everything you're hearing about supply chain issues apply to us as well. And the last slide is just a reminder that please reach out to us anytime that you've got a question or a comment on the hub or on Odyssey at hhsc.ca. And that's me done, Aaron.
Thanks very much, Dr. Lum. Next up on our agenda, we have Emmeline Grigorov, who is a Human Rights and Inclusion Associate here at Hamilton Health Sciences. And Emmeline's going to give us an update on trans health accessibility. Emmeline, what do we need to know today?
Thanks, Aaron, and good afternoon, folks. As Aaron said, my name is Emmeline, and my pronouns are she and her. And I just wanted to take a few minutes to talk to folks. As a reminder from our last town hall, November 20th was Trans Day of Remembrance. And this is a really important opportunity for us to memorialize those who have experienced violence and death as a result of anti-trans violence. And it's an opportunity to really continue to draw attention to the violence, discrimination, and exclusion that trans folks experience every day. At our last town hall, when Tiff was talking about the origins of Trans Day of Remembrance and the murder of Rita Hester, we did mention that while trans folks regularly experience violence, discrimination, and exclusion, it's so important to remember that this is especially the case for trans folks who are members of other historically excluded groups, including those who are Black, Indigenous, racialized, disabled, living in poverty, and more. And so I did want to take a few moments to talk to folks about trans intersectionality. In 2020, the United States Human Rights Campaign tracked a record number of violent fatal incidents against trans and gender nonconforming folks, and the vast majority of those victims of violence were Black trans women. Since 2013, the Human Rights Campaign and other advocates have tracked hundreds of cases of fatal violence against trans and gender nonconforming folks across 30 states, and they have determined that Black trans women comprise 66% of the victims of this violence, and this is intersectionality. In this case, these folks are experiencing an intersection of anti-Black racism and anti-trans violence. And if this is something that you would like to learn more about, and we do hope that you do, the Human Rights and Inclusion Team hub page is full of really great resources. And the one that I would like to highlight is that we do link to the TransPulse Canada 2020 report on the health and well-being among racialized trans and non-binary people. And that is a really helpful resource to learn more. If we could go to the next slide, please. I also wanted to take a moment to talk to folks a little bit more about pronouns, because as part of honoring Trans Day of Remembrance this year, we have updated our HHS email signature brand guidelines to really invite and encourage folks to offer your pronouns in your email signature and in your Zoom name if you feel safe and comfortable to do so. And so I just wanted to note for folks, you'll see on this slide quite a few pronouns beyond the gender binary pronouns of she and he. Folks who are two-spirit and trans or gender non-binary may choose to use these pronouns, but they may also feel more comfortable with gender-neutral pronouns like they or ze. Now, these are not the only gender-neutral pronouns in use across the English language, but they're ones that we think you are more likely to hear. And our suggestion for success when it comes to using folks' pronouns is to always just use the pronouns they use for themselves. As individuals, we know who we are, we understand our identities, we know what feels right for us. And so we really invite that if someone tells you what their pronouns are, use those pronouns. And we really invite this because using someone's pronouns and getting them correct is a really important way to build positive spaces and to show your support for everyone's right to live safely and well in their gender identity. And it really can make a world of difference for folks when their pronouns are used correctly. And when we make mistakes, as we all will as humans, we really do ask and invite that you apologize with sincerity and then move on and try not to make that mistake again. It's important not to belabor your apology and make it more about making yourself feel better than apologizing. And of course, a great way to indicate your support for folks having and using their pronouns correctly is to share yours as well. You can do this in your email signature and your Zoom name, as we discussed last week, and there's resources on the hub to support you. And you can also do it when you introduce yourselves to folks. So again, my name is Emmeline and my pronouns are she and her. It's a really easy way to open space so that others might then share their pronouns with me if they feel safe and comfortable to do so. And I'll just note that some folks may be thinking or wondering about how to document patient identity correctly to make sure that the name they use for themselves and their pronouns are what we use as a healthcare institution, regardless of if that matches up with their legal name or not. Epic is coming, and it is going to be so much more inclusive for folks. It's going to be such a great resource. But in the interim, if you would like to learn more, if you have questions, if you'd like to strategize ways to make our current systems as inclusive as possible, please know that you can reach out to our team at any time. We're always available at inclusion@hhsc.ca. And on our last slide, I'd like to invite folks, if you'd like to learn more, there is just a plethora of resources available on our team hub page. At our last town hall, Tiffany spoke to a whole bunch of resources that we recommend for folks, and you could certainly access that again via the recording. So today, I just wanted to take a moment to highlight a specific upcoming learning opportunity via the Faculty of Health Sciences at McMaster. On December 9th from 5 to 6:30 p.m., you can participate in a Zoom learning opportunity entitled Understanding Health Issues for Two-Spirit and Indigenous LGBTQIA+. We did put the registration link here on the slide in case that's helpful for folks who maybe are watching this Zoom as a recording, because you do need to register in order to attend this event. If you'd like to register, you can really easily find it just by Googling Equity, Diversity, and Inclusion, Indigenous Health Equity Speaker Series. And with that, I'll turn things back over to you, Aaron.
Thanks very much, Emmeline. Very helpful. I know Bruce Squires is our executive lead on our EDI initiative, our strategic initiative, and was going to give today's update. I don't know if Bruce has joined us back yet. He was called away urgently to help with a national conference that's going on and could only join us at 12:15. I did say that in the event Bruce wasn't here, I happily deliver these slides, but it means people have to listen to my raspy voice at least for a little bit longer. So bear with me and we'll get through this. I've been very privileged to be able to be part of the EDI Advisory Council, the President's EDI Advisory Council formed in support of this corporate initiative and to participate in the discussions that are happening at that forum. It's incredible work, and the team that's involved is very passionate, and I've certainly learned a lot in the process. As we go through that work, I think the end goal is to create a full framework to elevate HHS's performance in the areas of equity, diversity, and inclusion, which is critical for organizations of our size and impact, every organization really, but no more so than us. So that work is taking on a number of phases, and the phase that we are entering into now upon a great time of reflection has been to do a survey of our workforce. This is concurrent with some other work that's being done in partnership and supported by Ernst & Young to also try and assess all of our policies and processes across the organization and identify opportunities for improvement. So we also have a survey that's going to be going out to the workforce, a fully anonymous survey administered by a third party, whereby people will be able to provide their input, their thoughts, their experiences, and to try and put input into this process that is unique to you, which is such an important part of the work that's ongoing. And I know that the council is very interested in what will come out of that endeavor. So what do you need to know? Well, that survey is going to launch shortly, and it'll be available for a brief time from November 25th to December 9th. It only takes about 15 minutes to complete, and really time in your busy schedules to do that. It will be accessible in a variety of formats. I know that most people will predominantly do the survey online, but some won't have that benefit and will be seeking out paper copies, which will be available. You'll be provided direct links from the HHS Hub, from the dispatch and other sources, as well as a QR code accessible through the HHS app and on our social media channels for staff. such that you will have access to the survey and all those methods, and that you will be able to fill it out. I know, oh, I see in the comments that Bruce has joined. Bruce, I'm mid-stride here delivering this update, but maybe if you wanted to pick up on it in your own words, that'd be helpful for the group.
Well, thanks very much, Aaron. My apologies, folks, for being delayed on another conference. Thanks very much, Aaron, for filling in, and I really appreciate the opportunity to highlight the important EDI Workforce Survey that is being launched today. And I think Aaron has introduced this to you. Again, availability for the next 2 weeks, and really important, the variety of ways by which you can participate in the survey. HHS devices, your personal devices, paper as well. And it takes really only about 15 minutes to complete, but it's such an important opportunity. We have had many leaders, and you see here, involved from across the organization in reviewing the survey content. Can we go to the next slide? So I do want to speak very specifically to the confidentiality measures in place regarding the survey. So important that we provide a safe environment for you to share. Responses to the survey are confidential. They will be reviewed in aggregate only. The data will be compiled, and it's going to be summarized as a whole. There's no ability, and at no time will our consultants at Ernst & Young, EY, or anyone at HHS be able to obtain responses from or identify individual respondents. We won't be able to trace them back. It will not be possible. The results of the survey are going to be collected and collated by EY using this Qualtrics survey platform. So if we go to the next slide, how to get there. I really want to encourage you to take advantage of this. And if you can see, if you'd like to get started right now, you can actually take your personal device and hover your camera over that QR code. There you see it in the bottom right hand of your screen, and that will take you directly to the Qualtrics survey site. We're going to have more information about the survey. It was shared earlier today in the email, but we'll also have it posted on the hub, as well as reminders coming out over the next coming days and weeks. So thank you, sincere thank you on behalf of the co-chairs of the Advisory Council, Dr. Smita Halder and Dr. Sanjay Sharma, and myself, but also the entire council and certainly HHS leadership for you sharing any information. We know that has happened in the past, and I know Aaron highlighted it, but all of the information that's been collected really over the years is part of this review, but this up-to-date snapshot will be such a key piece. This is really the closing point. This is part of our journey and a really big step towards furthering an environment where everyone in HHS feels welcomed, respected, and included. So thank you very much.
Thanks, Bruce. Glad you could join us, and thank you very much for delivering that update. Next up, we're going to invite our President and CEO, Rob McIsaac, back to give us an update as to where we are on our vaccine management policy, which will take effect on November 30th, and to talk specifically about the next steps with respect to that policy. So Rob, back over to you.
Yeah, thanks very much, Aaron. Thanks to all my predecessor presenters for their updates. So I'd like to take the remaining time today to provide an update on our vaccination policy. Unfortunately, I do have some difficult messages to deliver to you. In September, HHS implemented its vaccination management policy. Of course, many will remember it requires all staff and physicians to disclose their vaccination status. And those who have not disclosed have been required to complete regular rapid testing. This was pursuant to Directive 6, which was issued from at the provincial level. So on that first part of our vaccination policy to date, 68 individuals have been subject to the discipline process for not complying by either not reporting or not submitting to testing. We have thus far dismissed 7 individuals as a result of that non-compliance. Now, between today and November 30, all remaining individuals who have still not reported their vaccination status will receive notice of immediate termination. The second stage of our policy involves mandatory vaccination. And as you are likely aware, our policy suggests that effective November 30, we required all HHS staff and physicians to be fully vaccinated or be subject to discipline. The evidence remains clear that vaccines are key in reducing spread and hospitalizations due to COVID-19. As healthcare providers, getting vaccinated is the right thing to do for our patients, for our colleagues, and for our community. Since HHS announced its mandatory vaccination policy in October, more than 900 additional staff and physicians have completed their vaccination, have been vaccinated twice. As of yesterday, about 97% of HHS's workforce is fully vaccinated. Just over 300 staff and fewer than 5 physicians remain unvaccinated. I want to say thanks to everyone who chose to be vaccinated, for choosing to do the right thing, and frankly, for choosing to remain working here at Hamilton Health Sciences. We need you. For those who remain unvaccinated on November 30, we will be issuing notice of termination on December the 1st. The notice will specify an effective date for the termination of January the 26th. We think this is a responsible timeline that provides an appropriate final notice period for those whose employment may be impacted by the policy. Individuals who have received a single vaccine dose by November 30 will have an opportunity to avoid termination by signing a written agreement undertaking to become fully vaccinated by January the 26th. I will hasten to add that medical evidence for those who are unvaccinated and choose to go on sick leave following November 30 will be closely scrutinized. Those without a legitimate reason, according to health, safety, and wellness processes and policies, will not have their medical leave approved or paid. I've said this before, and we'll say it again. The action of dismissing staff brings absolutely no pleasure, and it is not something we are doing lightly. We would very much prefer for all of these individuals to continue working at HHS. But people who choose to be unvaccinated have also made a choice about their employment by choosing to remain unvaccinated. It's my hope that after today's town hall, those who are unvaccinated or who are partially vaccinated will visit their local vaccine clinic. There are lots of appointments available, including walk-ins. Ultimately, we expect that we will lose colleagues as a result of this policy. We are prepared to take every measure necessary to address any potential impacts to hospital services as a result. We have done an exhaustive impact analysis. Of course, we can't complete that analysis until we know how many people will choose to leave the organization. However, we have made assumptions and plans for the worst case. Again, I want to extend my genuine, heartfelt thanks and gratitude to the nearly 13,000 staff and physicians who have taken the steps to become vaccinated. you are role models in our community. Now I'm going to turn it over to Michelle Leroux, who will provide some additional details about the HR process involving all of this. Michelle?
Thanks, Rob. So yes, we've kind of framed this in the format of a number of questions that we expect our staff and physicians may have. So I'm joined by my colleagues, Tiffany Roblin and Patty McEwen, who will assist me in walking through them. And I think Sharon also will be helping us here. So one question that we expect some might have is, why are we not moving ahead with terminating on December 1st? Why are we waiting until January? And we feel that's a responsible timeline that provides appropriate notice to those who their employment will be impacted. And, you know, Rob spoke to this giving an opportunity for all of those who are unvaccinated or partially vaccinated to take those steps. So that gives that additional time to go out and get vaccinated. And I think I'm going to pass it over to Tiffany next.
Thanks, Michelle. So we also do anticipate that folks would like to understand what it means for those receiving notice of termination after November 30th. And the question particularly of, what if I become fully vaccinated between December 1st and January 26th? Will Hamilton Health Sciences rescind my notice of termination? So individuals who receive notice of termination will, as we mentioned, continue to work and test bi-weekly between December 1st and January 26th. If an individual becomes fully vaccinated after receiving notice of termination, but before January 26th, we will offer to rescind that notice of termination. As Rob noted, we're not taking these actions lightly, and we would like to see these individuals continue working at HHS beyond January 26th. If you're someone with a single dose on or before November 30th, you might have the same question. So again, those with a single dose on November 30th will continue to work and test bi-weekly between November 30th and January 26th. They will have the opportunity to avoid termination by signing a written commitment to become fully vaccinated by that date in January. Those who do not commit to become fully vaccinated by January 26th will receive notice of termination effective on January 26th. And with that, I may hand it back to my colleagues as it relates to the remaining questions. And perhaps, I'm not sure, Erin, I know there was also a question in here for Sharon. I'm not sure if this is the appropriate time to ask.
Yeah, maybe. I mean, Sharon's on camera. I know Sharon, one of the questions that I had lined up to ask was about I know that, as Rob stated, there's, you know, we hope that many will get vaccinated between now and November 30th, but seeing as we don't know the number, what's the nature of the impact assessment? Now, what are some of the steps we're taking to mitigate the impact on how our operations will unfold?
Certainly, we've given this a lot of thought and considered the impact to patient care and access and to the other functions across the organization, but we believe strongly that nothing short of termination is the right thing to do for our staff and our patients in the community. We are advancing and implementing measures to limit how this may affect patient care and access. Leaders across the organization have been and continue to hire up to replace staff. And in some cases, we are hiring people as quickly as possible, also modifying scheduled care and looking at some other similar measures that we may need to take. Certainly, our hope is that those who are unvaccinated today will get that first dose in the upcoming days. And in fact, 900 more staff and physicians are now considered fully vaccinated since our policy was introduced in October. So thanks, Erin.
Yeah, thank you very much, Sharon. I mean, maybe for our HR colleagues too, I know the numbers came up in Rob's slides, but how many people do we expect? How many as of today? If notices were issued today, what is our current number?
Yeah, so we very much hope that the number will be small and will continue to get smaller from today on to the point where we have to issue these notices. Every day, more people make the right choice in getting fully vaccinated. And like Rob said, we really appreciate the almost 97% of individuals who have already done so. The small majority, which is less than 400 at this point, those who have chosen a different path and have refused to become fully vaccinated would be receiving notice of termination, as Rob had outlined. But again, we anticipate and very much hope that that number decreases even further.
And I guess insofar as somebody who doesn't choose between now and November 30th to get at least one shot of the vaccine and receives a termination notice, there's no opportunity for them to then rescind that termination by getting a shot of the vaccine after November 30th. Is that correct?
Correct. We would rescind that notice of termination once they become fully vaxxed at that point. So once they get the 2 shots plus 14 days, then absolutely we would rescind. But if individuals would like to avoid receiving that notice of termination completely, then absolutely please go and get your first dose before November 30th.
So I guess that's the most important message today, is for those that at least have not chosen yet to be vaccinated. If you wish to continue working at Hamilton Health Sciences, get that first shot. Yeah. I guess also just to be clear, I think we are posting all of those numbers and updating them as frequently as possible on our website, so that those that wish to take a look at where we're headed, what's going on, all of our workforce vaccination data is available online. Okay, well, I'm conscious of time. I do want to say that we had a very packed agenda today, and for a variety of reasons chose not to have our open Q&A forum. But really, that does not mean that the organization is disinterested in questions. We absolutely want to make sure that people have the opportunity to send questions to hhsnews@hhsc.ca. That's the best means for you to get an answer to your question about anything you've heard today. We will continue. There will be information provided to the broader organization about particularly the vaccine management policy following today's town hall. You can review that and continue to ask questions of your leader or submit them through this inbox. We'll feed that into the content that constructs our next town hall. As dire note as we are ending on, I do think it's important that we make some time for celebrations. There's a lot happening in our organization. There's a lot that needs to be recognized. And it's worthwhile to at least take a few moments to make sure that that work can be called out. So if you do have something that you would like to celebrate, a person or someone you would like to recognize, you can do so now. I see Leslie Gillies, you have your hand up. What would you like to celebrate today?
Oh, thank you, Aaron. I just wanted to say sincere thanks and gratitude to the entire palliative care team at St. Peter's Hospital. The COVID-19 3 West outbreak was declared over today, and wanted to thank everyone for their hard work and dedicated commitment to patients, families, and colleagues. Thanks, Aaron.
Wonderful, thank you. I do also see one of our attendees, one of our participants has a hand up, Vianney Lee K. I'll come back to you in a moment, Vianney, just to make sure that you raise that hand to, in fact, give a celebration. I know sometimes people do it in error, but I do see Kirsten Kroll with a hand up, and I know that means you want to give a shout out. So what would you like to celebrate today, Kirsten?
Yeah, thanks, Aaron, very much. I just wanted to acknowledge the work that Andrew Mole is doing this week and has already been for a little while with others as we prepare for kind of any sort of disaster that could potentially happen or possibly happen with the Grey Cup that is being hosted. Very exciting event on December 12th in the city. But with that, we always want to make sure that we've refreshed our minds around Code Orange responses, and just in case something strange happens and we're called to action. So thanks. There are tabletop exercises that have been happening this week, one today particularly for a few hours. And many people have been involved with that. So thanks everybody who have been engaged. And of course, it involves a lot of different departments to make sure that we are kind of all ready to be functioning in harmony. So thank you very much.
Great stuff. Thanks, Kirsten. Sharon Pearson, I see you have your hand up. What would you like to add?
Thanks, Aaron. I would just like to let folks know that Dr. Ralph Meyer will be retiring next week. So this will be Dr. Meyer's last town hall. Folks remember I had sent a message out in the summer that Dr. Meyer would be leaving soon, and that day has come. So on behalf of the organization, just acknowledging him for his many contributions over the last 9 years at Hamilton Health Sciences, and wishing him all the best on his retirement.
Amazing. Congrats to Ralph for sure. Oh, and I see Dr. Meyer himself with a hand up. So Ralph, over to you. That's a nice segue.
Well, thank you, Aaron, and thank you so much, Sharon. Sharon's been so kind over the last months. Barry will know this, but we go back a long way. I started as a student here in 1975 at the Hamilton General, the first place, and then what was then the Henderson. So as a student, a resident, a staff physician, and then with administration, this has just been a fantastic place to learn and a fantastic place to work. And want to thank all of the people that I've been associated with and all the well wishes I've received. So thank you all.
Wonderful. Thanks, Ralph. I saw Dr. Lung with his hand up briefly. Barry, was that, you decided to take that down, or would you still like?
No, it's legacy. I was going to do what Sharon did. So that's
Gotcha.
great.
Very good. Well, Rob, why don't I leave it with you for final remarks?
Yeah, actually, maybe could start off by just mentioning that this year is the 25th anniversary of the Articles of Incorporation for Hamilton Health Sciences. So essentially our 25th birthday. And I do think that's cause for some celebration. It's an extraordinary thing that the founders of Hamilton Health Sciences did in bringing together, the collection of hospitals that were present at the inception, and then the additional hospitals that have joined us over those 25 years, and ultimately to become, a really driving force in healthcare in our region and in our province and in our country. So anyway, I think you'll see activities and advertisements around this in the coming days and weeks. So happy anniversary to everybody at Hamilton Health Sciences. Also just wanted to also give a shout out to the President's EDI Council on all of the work that they have accomplished in order to get to this moment where the survey is going out. So like Bruce and Aaron, would encourage as many people as possible to take that survey. I think that does it for today. I know the business about the vaccine mandate, there's some difficult messages there, but I think we have to bring that issue to a close, and so we will do so in the coming 2 months approximately. I'm hoping that the impact will be as minimal as possible based on the response of folks who are working here. So having said all of that, thanks to the presenters and thanks to all of you for attending today. Cheers.